A hearty good afternoon to everyone, a good evening to everyone. Welcome to our session on postpartum problems. We're glad to have Dr. Rashmi Patil among us today to help us understand this topic. Now, we understand how life changes after giving birth to a child, but we could also experience a number of physical changes after giving birth to your child. So, let's understand this entire process as we go ahead. Doctor, you have the stage.
Yes, thank you so much for the introduction. So, I am Dr. Rashmi Patil, consultant obstetrician, gynecologist, lab surgeon, and fertility specialist at Apollo Cradle Hospital, Jayanagar, Bengaluru. So, very warm welcome to all of you. So, today's topic is an interesting one because one or the other time we all have experienced or will be experiencing the postpartum period. So, what does this exactly mean, the postpartum period? So, it will be considered from the time that you give your child birth till 6 weeks after the delivery. Now, speaking about the delivery, the mode of delivery could be different, as in normal delivery, the assisted delivery with the use of instrumentations like forceps or vacuum, or it could be a cesarean section. So, whatever the mode of delivery is, the recovery again it depends. If the normal delivery is there, then the recovery could be a little faster. Instrumental delivery could take a little time longer, or the cesarean section a little longer than these two. So, it all depends upon the mode of delivery also. But the period of this delivery, as in 6 weeks, is common for all. Speaking about this period, how it changes the life being a mother. So it's a sudden switch over, one moment, and everything just changes. So a mother has to adapt herself. It is not only the birth of the child, it is the birth of the mother, right? So she has to adapt herself physically, emotionally also. We have to go through all these problems together. So, speaking about episiotomy, so it is one of the common small surgical procedure we can say, deliberate cut that is given on the perineum down below, so that it could help the delivery as such. Or you do some maneuvers or put an instrument also. So every mother may or may not require this procedure. If it is given also, it is a small cut extending up to some 4 or 5 centimeters, and few stitches or even the absorbable ones with the single line that also could be put underneath the skin. Speaking about the care of this episiotomy, so it would take a couple of days to 7 days to 10 days or something to heal properly. The skin should get approximated. Women are advised regarding the personal hygiene, the perineal care, how to wash the area, how to keep it clean and dry, then what precautions they are supposed to take, not to sit crossed legs down below, not to put more pressure, and if there are any signs that the area at that stitch site it gets warm, or any form of pain that persists, or if they feel that there's a swelling which is appearing, it could be a blood collection also, or it could be sometime pus formation. So women are advised generally to take good care of the this area as such, so that local hygiene is very important, and maintaining the perineal care is very important. Every woman, generally if we see, next would be the kind of the blood or the discharge what they have after the delivery, that we call it as a lochia. So that could persist for a couple of weeks also. Initially after delivery the bleeding is fresh, so it will be red in color, bright red. Later on it starts decreasing in quantity as well as the color changes. So slowly it starts turning its color. It starts becoming pinkish, then yellowish to white. So it would take some time for this lochia to settle down. This is normal after the birth, and it would take a couple of weeks. This should be explained to the patient. And if there is any foul smell discharge at any given point of time, or pain in the lower tummy, or the mother feels unwell, or if they experience pain to touch, so they develop fever. So all these could be signs of some infection down there also, and that could alarm them. So these are the red flag signs that the women should be aware about, and they should contact the doctor and the hospital, the emergencies immediately whenever they feel such problems. So it's always advisable that at the time of discharge they have few emergency contact numbers where they can contact the doctor or they contact the hospital, or they can just rush into the emergency also. Speaking about this, yes, hygiene and the local care would be explained to them at any given point of time. Anything that a mother feels abnormal, she has to report back. Some painkillers will be offered. Sometimes antibiotics will be given in case of an episiotomy. Also, if it is required, local ointments can be given. And during the hospital stay, there are radiations which will help in the better healing. Also, then there are sitz bath which will help in soothing the area, and local numbing agents can be given. So all these help in the perineal care, the local wounds, and help in the recovery faster. In case of cesarean section, if the mother has a cesarean scar, generally advised that it would be most of the time we put as the absorbable stitches over there, and the mother will be asked to do a follow-up care for the wound care as such. And generally nowadays we use all the water resistant the stickers over the scar so that mother could take bath, but care should be taken that the water shouldn't seep inside at any given point. And if it gets wet also, it should be removed and the doctor should be consulted. New dressing can be applied, or if the wound has completely, the skin has opposed to each other, it could be left open also. So care is taken that any discharge from that particular wound site, if they feel it's getting red or there is pain, they have to report back immediately, especially if the weight to height ratio is of the higher side, and the fat content below the skin layer, if it is a little more, so the chances of infection could be there. So local care is very important. And after cesarean, the antibiotics will be given for a couple of days also to continue. So it is very essential that complete the antibiotic course that is given. And all these painkiller medicines, the antibiotics, whatever are given, are both baby friendly as well as mother friendly. So it's important that it doesn't affect the baby through the breast milk. So which are safe for the baby, that those antibiotics will be given. So this will be about the local care of wound. And women will be advised not to do heavy work or lift heavy weights, especially until the internal stitches everything heal. So it could take a couple of weeks to almost 3 months for a mother to gain a full strength in the tummy. Generally, they ask whether when they can resume the activities as such. I would suggest that as soon as your body permits. So not to do what heavy exercises or anything like that. Normal walking that could be allowed, and not to lift heavy weights and all. Taking care of baby, lifting baby, yes, it is generally it doesn't affect anything as such. But something like more than 10 kgs or something, lifting a heavy bag, so we do not advise that, at least for a 3 months, until mother completely feels that there is no pain or a pressure that she feels on the wound site. So that is very important to take care. And of course, about the wound care, the follow up will be given a date when they are supposed to come back to the doctor, and we see the scar whether it is completely healed. We ask in detail about what symptoms they are facing, and how good treatment, if anything else is required. So that has to be provided to them also. Speaking about the urination and the motion works and all. Some mothers may have difficulty in initiating the urine, and that could cause some retention also. We call this as a postpartum voiding dysfunction. So, after the delivery, normal delivery, we ask the mother or encourage them that within 6 hours of birth, so they are supposed to void the urine. If they are not able to do so, they have to inform the caregivers over there, the nursing staff, the doctors, that it's getting difficult to, void the urine, or they are feeling some pain in the tummy down there. So it's very important, because sometimes these muscles around the opening of this urine pipe, we call that as a urethra, even they undergo some spasms. There could be some difficult deliveries where the baby's head has been pressing this water pipe for some long time, or there could be some instruments which have been applied, so the mother feels difficult. There could be epidural anesthesia, where again the mother does not feel the sensation as such. So sometimes these could hinder the proper voiding of urine. So care should be taken that if she is not able to void urine within 6 hours after delivery, she need to inform also. Plus, even it is going to be documented in the notes that after delivery, she is able to void the urine. So that is very important. Next thing about the bowel habits. So it's essential that sometimes there could be tear in this back passage. So a small amount of tear, which is of just superficial, will be stitched together if it is extending to the muscles that control the back passage. Sometimes there could be like leakage of either the flatus or sometimes the feces. So a good control on them, the stitches or the dietary changes, these inadvertent or unexpected injuries, they'll be taken care of, and a proper instruction will be given that how they can gain the muscles around the back passage. There are exercises, the pelvic floor muscle training exercises. So under special supervision, this can be practiced. There are physiotherapists who will help you out with these kind of muscle strengthening exercises also. Most of them, they become symptom free, probably like 4 weeks, 6 weeks, and all, and they're able to have a good control. Some may experience like having this problem even close to like after few couple of weeks also, or some months also. But generally, like if you see 6 to 8 out of 10, they are able to get a good control over a period of a year, and they are symptom free by that time. Very few people may require further intervention by the bowel surgeon. So these kind of incidents, they are very rare. Even if it happens, proper care will be given and a proper guidance will be given about how to take care further. So these are the few things where even the bowel habits could get affected. Otherwise, if there is a minor stitch or something, we do not ask them to undergo through constipation or something. So we give them stool softeners if they require. So they are advised that not to strain at stools, especially if they have a cut down there. So it's very important and not to sit cross-legged. So they should sit in a comfortable position, and they can take help of some pillows also if it requires. The exercises again, squeezing exercises, they can start practicing once their body permits and the pain has come down, so that the muscles, they regain all the strength back. Because it is been observed that some of the urinary complaints or the complaints like the walls of the vagina or the uterus and the cervix, which we call down there, so these supports may lose the strength as and when the age advances. So after the childbirth, it is essential that we regain back this muscle strength down there. So these kind of exercises you can do once the wound has completely healed and your body permits to continue with these exercises. We call them as Kegel's exercise. So you have to do 8 squeezes of the muscles down there 3 times a day. You can do, and you can continue for as long as you want. So that helps in having a good control on the urine as well. Then a good support. The muscles get stronger around the uterus and just supports. So the womb and the support, they are getting stronger by these exercise. So that is one more what we suggest. Few women, they ask that when are we getting our periods back or regularity of this menstrual cycles. It all depends. It is your individual body habitus that how your hormonal changes occur. Everybody is different. So some may regain their menses close to like 1.5 months, or it could be like 2 months, sometimes even 9 months to 1 year. They are not regaining the menses back, but that is normal as long as there is no other pregnancy down there. So uh, you have to be like it is quite acceptable that menstrual cycles may get disturbed. The reason behind is you're breastfeeding the baby. So whenever you're breastfeeding the baby, the hormones which are helping the breast milk production, the secretions, everything, they tend to delay the cycles also. So it is quite normal. Then after you slowly taper down the number of feeds that you're giving, sometimes these cycles, they become regular. So kind of an hormonal changes are there. It is quite acceptable that the one woman, she got her menses like 1.5 months, doctor, but I've been like 9 months, and I still don't I have my menses again. So is there any problem with me? So absolutely not, I would say. It is all normal as long as your body is responding to all the hormone, everything, it is going to regain back your menses, and it will be as regular as it was before. So nothing to worry regarding the menstrual cycles as such. So everybody is different, and it depends on how long you're breastfeeding also. So all the hormonal changes, it tends to reverts back after the 6 weeks. So things are going to settle. About women, they ask about exercises, the tummy exercises, when they can resume and other things. For normal delivery, generally there are no restrictions as such, because the tone, it tends to come back easier, and there are no cuts or any surgical procedure that have been done on the tummy. So it's only the down below. But so we are not telling them to do something with in this perineal region. We say the muscles down there. But tummy exercises, yes, you can do that. So most of them ask, like, after 10 days of follow up they come. So most of them ask, like, doctor, my tummy is still bigger, so when is it going to, like, become small or something? But I would say it has taken 9 months to, come to that bigger size. So you cannot expect it like deflate like a balloon and within like 10 days you're back to normal. It takes little time. Everybody is different. Again, I would say that the water content in your body, you have given a childbirth, so baby's weight, for example, 2.8 kg, 3 kg, you're losing suddenly that much weight, plus the afterbirth which comes out, the placenta, that much amount of weight again is reduced. The water content of your body gets reduced. The uterus or the womb, it starts shrinking. So immediately, like within, after delivery itself, there are at least 5 6 kgs of loss suddenly. And then the water content slowly comes down and settles by around 7 to 10 days also. So you can see that when the women comes for the follow up, there is a drastic change in the weight. I do agree for that. But about the tummy, it is the muscles that have been stretched. It has been ballooned out for holding the baby inside. It cannot come back to its strength immediately. It is going to take some time. You have to give that time, and you have to maintain that kind of a tone. So do not leave your muscles lax. What you can do is you can try to hold the muscles together inside the core, what we say. Try to squeeze in your muscles and try to maintain that posture. That is very important. So you can just hold on your muscles together. And if you're going to leave it relaxed or loose, so sometimes the muscle keeps that memory that, okay, I'm supposed to be like this now. So it is in your hands that how you train your muscles. So slowly and steadily, things are going to be fine. The muscles will gain back their strength. You have to also put in efforts for that. So you have to train your muscles slowly, try to hold it in together, not to do aggressive exercises, especially if you have a cesarean section. So after 3 months and all, you'll be resuming the other exercises as well. But in the initial phases, what I would say, only holding the muscles together, like squeeze in and just hold them together. That is very important. It gives slowly the tone also, it starts improving as the days pass by. This is very important. The other thing is about the posture of the mother. When they are breastfeeding, I generally say that you have to give a height. Like if you're taking the baby on the lap and sitting, you do not have to bend so much forward, right? You start getting the pain in the neck and the pain in the back as well. You have to take some pillow on your lap so that the height increases. Place the baby on the pillow nicely, hold it in your arms, and then feed the baby. Do not bend at your neck, also. This is what I would suggest. Most of them start complaining about the neck pain or the back pain. I would say have a comfortable position when you're feeding the baby, because it's not a single day matter, right? You have to feed for like year together. So it's not, and that too multiple times a day. So it is not a single day job or a single event that you're doing that posture, right? You have to maintain a good posture, hold the baby in a correct position. You should be comfortable, the baby should be comfortable every time that you feed. And I would suggest, most of the women, they try to sleep and feed the baby. I would suggest not to do that. Just be sitting comfortable, have a contact with the baby, look at the baby, develop that emotional bonding. And whenever you're feeding, then you can talk to the baby also, do something like that. When you're sleeping and feeding, sometimes you tend to like oversleep towards the baby. So that could put some pressures. So always try, let it be the midnight also. I would always suggest that please sit and breastfeed the baby, as long as it is not contraindicated, like you do not have some injuries or some comorbidities that you're not able to sit properly. So as long as your body permits and it's in your hand, you can sit, take the baby on your lap and feed for the baby. It is going to take like a couple of minutes. Some babies are slow suckers, so they tend to drink milk very slowly. So they would take some half an hour also, but that's okay. Slowly and steadily, they are going to learn. There are lactational specialists who are going to help you out with this. The baby doesn't learn everything and come out, right? We have to give time for the baby also to learn certain things. most of the reflexes are well established, but some babies may find it difficult to latch. There could be some disparity between the nipple size, the mouth, or the position, everything. So take help of the lactational specialist. Try to feed the baby. The baby shouldn't be hungry. So either you can express and feed the baby with the palada, or if try to change the posture, then baby will learn. Definitely it has to learn. The baby is dependent on you, so definitely baby is going to learn. So give time for the baby to learn how to breastfeed also, and at the same time even you have to enjoy the breastfeeding. Speaking about breastfeeding, again, there could be some complication in initiation of the milk. So as soon as the baby is born, as early as it permits, we try to bond the mother and the baby together so they can start feeding. After normal delivery, then within like a couple of minutes, if she's comfortable, there is no complications, the baby is doing fine, the baby doesn't need any further care from the pediatrician side, they will be handed over to you. You can start and initiate the breastfeeding as soon as possible. Cesarean section, it may excuse me, take some time. So it depends how your condition is, how the baby's condition is. As soon as it permits, you can start breastfeeding the baby. About milk production, it may take some time. Yes, I do agree, but always try to latch and give your feed the first time. Afterwards, if it is not baby is not sucking enough, then only feeds can be expressed and given. But always try to latch first. So the baby tries to learn. Otherwise, it's going to find the easier way. So always make sure that you take the baby, attach the baby, and somebody else holding the baby for you. I wouldn't encourage that. It is your baby. You have to bond with your baby. So if everything is fine, your hands are free, you do not have any problem in holding the baby. So always hold the baby in your arms and then feed. The bonding is really different rather than someone else helping you holding the baby and you're sitting and feeding. That I wouldn't encourage. If it is permitting, your body is permitting that, please hold the baby in your arms and then start feeding. The baby gets bonded really well and it tries to feed on you really well. The second thing is the hard lumps that you could get. All the pores and the ducts that carry the milk may not be open at the time when you start feeding for the first time. It requires gentle massage. So lactation specialists, they will also help for you. What I would suggest, when you're taking bath, just can apply some coconut oil or something and try to massage your breast, and slowly you have to massage and bring it out towards the nipple area. The small pores which are there, they open up. So rather than somebody else doing that for you, if you do it yourself, you know how much pressure you are supposed to apply. Otherwise, it could cause pain. It could cause like some trauma to the breast tissue. Gently massage and open up the pores by yourself. So do not allow the breast to become hard. That I would suggest. Feed the baby alternatively on the different breasts. So if you're doing it on the right now, then next feed should be on the left side. So once the baby takes the breastfeed, if you feel that the lumps are still there, then please massage and express the milk out. That is very essential. The breast should be full, but it shouldn't have any lumps. This is very essential. If there is any unexpected lump, then that requires a different investigation and care as such. But as long as it is only the breast milk that is creating the lump, make sure this happens. Otherwise, there is a problem that the tissues surrounding could get inflamed, and that could cause mastitis, what we say. That could require some painkillers and sometimes antibiotics to bring it down. In case if it is not controlled as well, it may lead to pus formation also, and that could require a small cut and drainage out of the pus. So care has to be taken that there are no lumps and you don't feel feverish or ill. And even if it is just a mild inflammation, you can still continue to breastfeed the baby from that side also, not to stop completely. So that is important, and take help of your doctor and the lactation specialist in such breastfeeding care as well. Speaking about diet, I would suggest as long as you're on antibiotics, maybe some spices can be avoided because some antibiotics may cause acidity, and antacid can be backed up with. Otherwise, you can resume your regular diet as such. So there are no like major restrictions, anything that you're supposed to eat this, you're not supposed to eat that. So regular food which you're comfortable with, you can start taking that. And water, especially, many people have the myth that after delivery you're not supposed to drink a lot of water because it causes the milk, it gets diluted. It's really wrong because post delivery the mother requires a very good hydration. If there is lack of water content, the blood gets tends to become thicker, and we call something as a blood clots that could develop in the legs as well as in the which could travel to the lungs also. We call that as a deep vein thrombosis and pulmonary embolism. This is a very serious condition. So a mother should take care that there are certain risk factors, contributory factors. We assess them and we give them certain preventive measures. Then there are some mechanical methods and there are some injections to keep the blood thinner. So these are very essential. So the best ones are drinking lot of water and mobilizing yourself. So as long as you're moving around, your leg muscles, they are going to pump that blood back to your heart. So mobilization is very important, and in a comfortable way, I would say, not to make big lapses or something like that. Just moving around in your room also is very important. There are cases I have seen that after delivery, after cesarean especially, the mother is not even allowed to keep her feet on the ground. So this is really a wrong myth. She was lying there for days together, and what did she end up with? Having clots in the legs. And because of that, the limb size has become double, and she was in extreme pain. So we had to immediately admit, give the blood thinners, and start off the management immediately. And in case if the clots travel to the lung, it becomes a life-threatening condition for the mother. So it's very important that hydration is very essential, because the mother is losing her water through sweat, it could be through urine, through breast milk. So in a lot of ways she is losing her water content. She has to be hydrated well, otherwise these risk factors could develop the thrombosis or the clots in the veins. So it's very essential that if somebody tells you not to drink water, please take a suggestion, because that is really a wrong myth that has been carried since ages together. You have to keep yourself hydrated. It's not necessary that you're supposed to drink hot water or something like that. I would say any sterile water or boiled and cooled water, that is fine. According to temperature, whatever feel, if you like to drink hot water, you can drink that. You like to drink warm water, you want to drink room temperature, but make sure that you're hydrating yourself really well, at least like 2.5 to 3 liters you're drinking really well. So excuse me, that is very important. After delivery, there are few points like if a mother has a pre-existing condition like diabetes, thyroid, blood pressures, anything, a follow-up care is important, because most of the time sugar gets under control, the BP gets under control, thyroid medications may need to be tapered down or stopped. But at the same time, it could go the other way also. It is very essential that a follow up care plan is required. Please consult the specialist who is dealing with this medical problems, as well as your doctor gynecologist who has delivered you, because in close liaison you are supposed to take care of both the conditions, your delivery as well as this medical problems that are there. So the pre-existing conditions, they require a special attention as such. And take care about the baby's immunization as well, and make sure you're attending the scheduled appointments. That is very important. And speaking about resuming sexual activity, it all depends upon when your body permits to have a sexual intercourse. So you can resume that, but make sure you're using an effective contraception. So contraception choices can be discussed during the pregnancy also with your doctor. So please approach for that. It's important that you space between your children. If you want, you can give a good amount of like at least 2 years or something, so that you can give good time to your baby and then you're ready for the next pregnancy. So to prevent any unintended pregnancies, you can always bank upon these contraceptive choices. So you can discuss with your partner, with your doctor also regarding well. And take good care of yourself and your baby, because both of you are very important, and there could be some emotional changes, disturbances. So this perinatal mental health and what we say, because she could have some blues, some depression or some psychosis, what we call it as terms. So these emotional changes are expected, and most of them they are able to cope up with this, but some may require additional help. So I would suggest that any emotional challenge that you're facing, please talk to someone. It could be your husband, your partner, anybody, or your mother, your parents, your sisters, siblings, anybody, or your doctor. So please approach somebody, share that emotional change that you're having, and be open about that. It is quite common, because one day suddenly your world changes. So to accept that, it would take some time. So that's okay to feel that way. If you feel like crying, then just cry and vent it out, but be happy the next moment. So it's really important that whatever emotion you have, you share with somebody. So the changes could be from minimal to it could be severe. So some may require help in terms of medications as well. So anytime any help that is required, so please approach a doctor, please approach somebody who can with you, like you're able to discuss everything. So I wish all of you good health for you and your babies, and I hope this talk was helpful for all of you. Thank you so much. The burning sensations could take some time. So either it could take some 10 days or sometimes some weeks also, but slowly and steadily this is going to settle down, Archia. Till how many months need to feed the baby? As long as you can, dear. Okay, so there are no more questions. So take good care of yourself. Thank you so much for having me here.